so excited today. I'm here with a great friend and colleague, Dr. Latasha McIlwaine. Thank you for joining me today, Dr. McIlwain. I am wanting to discuss with you a topic you have a lot of experience, a lot of education around, and that is the development of counselors. So we're going to go into looking at your experiences working with counselors and training counselors, also the supervision aspect of becoming a therapist as well. And I believe you're licensed in Georgia, South Carolina, and North Carolina. So you can provide a lot of detail. But before we go any further, I'm just going to give you the floor to introduce yourself and tell the viewers a little bit more about your background.
Okay. Well, thank you, Chris. I appreciate it. Thank you for having me here for this interview. And just having this conversation with you is a great thing for me. So, I am Dr. Latasha McIlwaine. I have a doctorate degree in counseling psychology. My master's degrees are in counseling and health administration. And then my bachelor's degree is in sociology, minor in criminal justice. So for the most part, I'm licensed in North Carolina, South Carolina, and Georgia as a, let me get it straight, as a licensed clinical mental health counselor, supervisor, and a regular counselor in North Carolina, as well as in South Carolina, I'm an LPCS and an LPC. In Georgia, I am a LPC, but in Georgia, I am also not internationally, but nationally, I'm a approved clinical supervisor, and that makes me a supervisor in the state of Georgia as well. So, yes.
Definitely. Yeah. And with all that training, all of the steps that you had to go through in order to obtain all the credentials, what would you say the most important components of your training? What were those components that made you the supervisor you are today, if you had to reflect on all of the training you've obtained?
So I think when we start thinking about being a counselor, it's just a lot of really being in the moment and knowing kind of what you're looking forward to do. And when I say looking forward to do, as in how you're wanting to connect with clients, how you wanting to work with the patients for the most part, and then how you want to be that professional. So I think all of that helped shape me moving into just being a counselor, and then me becoming a supervisor as well, and wanting to help other counselors shape their profession, their lifestyle, the whole situation of it, in order, the education, everything, in order to become that counselor, that professional, that supervisor as they go on in their careers. So for the most part, I think it's really knowing yourself, and it's a lot of soul searching and digging deep, knowing that, that there are things that go on, and there are things that you definitely want to be able to work out for yourself. And you want to be able to connect with your patients, because a lot of your patients go through some of the same things or similar situations, and you want to be able to assist them. So I always tell everyone, it's a big soul searching event in your life. So yes.
Gotcha. I'm glad you mentioned that too, because the counseling field is so broad with a lot of different specialty areas. On my videos and on this channel, we go deep into relationships. What would you say your specialty areas are, and how did you find them?
So my specialty areas are substance abuse, domestic violence, anger management. I definitely work with a lot of individuals that come through the court system as well. We still do mental health. We still definitely focus on a lot of individuals who are dealing with some of the persistently mental illnesses. But with the persistently mental illnesses, I must say, we end up assessing those individuals and then getting them to the right individuals they need to really be with, the right services they need to be with as well. I always tell people that with certain diagnoses and certain mental illnesses that we're dealing with in our field, an outpatient therapist might not be enough for a patient. So we want to be able to kind of, and I say it loosely, kind of case manage a little bit with the patients in order to help them find those additional resources out in the community that's going to be assistance to them, and is going to be able to help them move further in their treatment and getting what they need.
Gotcha. So a big piece is making sure that if you don't have the skill set, or the client needs a higher level of care, you're able to point them in that direction.
Absolutely.
So therapists that are in training, how do you drive that point home for them? when it comes to niche and making sure that if they don't have the skill set yet, they can get the client to the appropriate person?
So one of the things that I do with a lot of my intern therapists that come through, or interns that come through that are in our internship program, we actually have them identify a lot of the different types of resources in the community. So we have them study that, especially the community here in Charlotte. In North Carolina, we definitely have them to kind of look at what's kind of happening and what's going on in our community, figure out what's happening, what's going on with these patients. And as the patients are telling them about these different things, that they become very rounded in that. And that digs a little bit deeper into what we do in our nonprofit as well, being able to help clients to link with services and help them be more knowledgeable about what's happening and what's going on with them for the most part. So that's kind of what we deal with when we're talking about our interns being well-rounded, have that case management piece in there too. And again, like I said, I use case management very lightly when I say it because we are therapists,
Right.
but we still need to be able to direct and guide our clients onto different levels, or our patients onto different levels of services that they may need. An outpatient service, which is what most of us do, an outpatient service it won't be the type of service that is needed for a person that might have a number of things happening in their lives, or a number of situations that are kind of twisted out of control right now. So with that being said, definitely having the counselors or the interns to kind of figure out, okay, if I find out about this, and then networking also. I find out about this, I find out about this person, I find out about that person, I find out about this service, I find out about that service. So I always tell them to keep their minds open when it comes to the community, and always to kind of dig deep to see what's out in the community also. I think sometimes we get kind of tunnel vision when we're in our education, and when we get kind of that tunnel vision, we kind of forget everything else that's happening and going on around us. I can remember being there myself, but I always tell everyone that we want to be, again, well-rounded so that we can help our patients. We got to be able to help the clients through the different services and the different services and the different avenues that they need to be going down. So yeah.
And you know, you and I have had several discussions over the years around making the appropriate referrals.
Yes.
And I love hearing that you're guiding your interns and the therapists that you're training toward building those relationships and networking with other therapists. You make a great point too about the environment, the community that you're practicing in. Make sure you have an understanding of what's being offered and what's not being offered. And it sounds like that's how you can fill in the gap. And, you know, you do a good job too, not only as a clinician, but as an entrepreneur, a woman, you know, of business as well. Do you mind sharing a little bit more about how you prepare your therapist in training to not just do the clinical component, but also look at the business side as well?
Absolutely. So that's one of the things that I do pride myself on. I do, when individuals come in for internship or decide they want to come and join us for internship, I do have internship assistants now that help me to kind of we kind of vet out those individuals and make sure those individuals are looking for some of the same things that we're offering. One of the big things that we do offer is we look to help you get from, okay, I want to be right now I'm a counseling student. I want to get my internship done, but I want to get my internship done at an agency where I can grow and kind of spread my wings as I start to, develop, and as I start to, as I graduate, as I move on and say I'm going to get an additional master's, or I'm going to get an additional doctorate degree, or I'm going to keep on going, or whatever the case may be, and all this additional training that we all have to have, which is very new for a lot of people. When they meet me, they're like, you mean to tell me I have to do 2 more years of supervision? Yes, I'm sorry you didn't learn that through your program, but yes, you will have to do 2 years of supervision. And so I try to tell my interns that, and then I also try to offer them the opportunity to come through with us and do some of that clinical work and some of that supervisory work, some of that business building work along with us as an intern assistant after they are able to get their internship hours together and get the graduation done and everything. Then if they would like to, they can come along with us, and I teach them everything I know. Pretty much it's just teaching them, knowing about business, knowing about the clinical side of things, as well as of late, we've started with a nonprofit. So we've been actually starting to help individuals out with that side of it as well. So it's a lot of different things that we try to put into play to make sure that individuals know that this is a career, not the fact that I'm just going to be sitting down talking to patients or clients all day, but this is a career where I can do things that's going to be helpful and I can really have an impact on the community as well. So that's what we really push and drive home with interns that are coming to our agency and would like to become an internship with, be in the internship program with us, and then want to continue on after that. I do offer them supervision as well, and we kind of move on to create that relationship and continue to grow.
Gotcha. And I do want to, echo the fact that the profession is more than just sitting down and talking with people. A lot of therapists in training may see something on TV and they only see the delivery of services, but they don't see all the backstage work that's required, behind the scenes work. What would you tell therapists in training or people who are thinking about becoming a clinician when it comes to all of the work beyond just delivering the service in front of the client? What does that look like from your lens?
So from my lens, it's really a lot of research. That's what it is. And I think going into my doctoral program really prepared me for that also. But just all that research that you need to know your community. You need to know what's happening. You need to know what the hot topics are right now, the biggest events that are kind of happening and going on in the community where patients are coming in or clients are coming in and things are happening. I mean, of course, I have the privilege of being in other areas besides my own practice as well, that I see different things that are happening in the community. So a lot of times, if you were to call me up and ask me about, well, kind of what's the new drug out there that people are showing up in the hospital with, I can kind of give some insight on that. Well, right now we're seeing this and we're seeing that. So it's just, making sure that people understand that there's a lot of research to go along with it. Along with that research, I would say that it's, again, networking, getting out in the community, knowing people, and it's really trying to figure out, what is the main things that are causing clients to have these, or patients to have these major breakdowns. And right now, I'll be honest, of course, in the Charlotte community, although we're saying, oh, we're therapists and we do substance abuse, and oh, we do anger management, and oh, we do domestic violence, or oh, we do couples counseling, we do mental health. But then you think about it, right now we're dealing with a housing crisis. So a lot of our patients, our clients are coming to us because that's a lot of stress to try to figure out, where you might be able to take your family, if you're going to be able to stay in the city, or you're going to leave the city, or you're going to go on the outskirts, So there's a lot that's happening that I don't think people really understand as I say simple outpatient therapist, meaning that you're just focused on your therapy, but there's a lot of different aspects that come into your patient or your client that you're working with that we have to be a little, concerned about, not a little, but really concerned about, because we're trying to help them maintain their mental health and not having a place to stay. We know the homeless population has definitely doubled and tripled in our area. That's a big thing. A lot of families are reaching out for assistance right now, especially since the coronavirus. A lot of people are reaching out for assistance.
Yeah, you're really speaking my language right now when you think about the systemic delivery of care. And a lot of clinicians that are up and coming, going through school right now, may only see the counseling as the talk therapy, but that other component is critical, because how do you have talk therapy with a client that's going to be successful if the focus is on where they're going to go home and sleep tonight, or what they're going to eat, or if their children are going to be in school, or like you said, the coronavirus, there's so many different other aspects that we as clinicians have to be more mindful of. And how do you train your interns, your therapists in training to have that third eye to see beyond just the school, the delivery of care? What would that other perspective look like?
So basically, with my interns, I do try to take them through. Okay, when we do our supervision, we're talking about what's happening. We're talking about current events. We're talking about what's happening in our area. We're talking about what's happening in the world, of course. But we're definitely pulling all this together. And a lot of times, I know people will say, "Oh, really? You do that with your supervisors and your interns?" Yes, I do.
Give an example.
Example would be when we're sitting down and we're having a conversation. I'm asking them sometimes, "What's happening in your life right now? What has turned upside down since this coronavirus hit? What has changed for you? What's happening?" And then they'll start talking about these things, and before you know it, now they are connecting. Okay, so I get it why my patient or my client is saying this, that, or the other, or they're having a hard time with it, because when I think about it, I'm having a little bit of a hard time with it, or so they start connecting the dots. So I do try to go in depth into situations and different things that are happening. And sometimes I'll ask them when they say something about a patient or this client did this or did that. I'll say, okay, let's put yourself in the client or the patient's shoe. Let's do that. Let's do that for a little while. And when we do that, that's when they realize that, oh, I get it. They're having a hard time at work, or they're afraid they're going to lose their job because of coronavirus. It's not secure anymore. It has become a situation where they're not sure if when they go to work the next day, it's going to be their last day at work. Or they're going to get the call before they get there.
So, Dr. McIlwain, you were describing how it's important for the clinicians that you train to see beyond just the talk therapy component, and also identify within themselves what they're experiencing. And it sounds like that helps the therapist better promote empathy and understanding for the client. And you mentioned how if the therapist is able to look at an event that's happening in terms of how it's impacting their life, then they can put themselves in their client's shoes. And I think about how we as therapists are the tool. We're bringing ourselves into counseling, and we have to stay sharp. We have to self-care. And I want to ask you about ways you help therapists that are in training to be mindful of self-care and being in a position where they can stay sharp.
Absolutely. So a lot of times, first, the position of staying sharp. Being in that position, I always tell my therapist, yes, you guys have to supervisees, interns, fellow therapists now. Yeah. I tell them all, look, you have to make sure that you understand what's happening, what's going on. You have to make sure that you are researching. You are making sure you can kind of put some practical experience to what's going on, to how things are happening. Just the whole gamut, to be honest with you. And I always tell them self-care is the other piece of it. So you can't be your best self if you're not taking care of yourself. Yeah. You want to take care of everyone. We all do. I would love to counsel this entire world if I could. I would love that. I would love to be the therapist for the world. However, that's something that we have to be able to take on and be able to do. And if I'm the therapist for the entire world, then I'm going to need some time to take care of me too. Or I can't be that great for everyone else. So the goal is really to focus on self-care and focus on just being able to take yourself. And I'll tell people this is, I guess, not even off the record, but this is just something that people don't realize, that along with counseling and knowing my whole, the clinical part of things, and knowing the techniques and knowing the theories and all that good stuff, everything that we do, and having that talk therapy, from time to time, that talk therapy should be evolving into additional parts of what's happening in people's lives. So if someone mentioned to me, right now I'm just having a real hard time with finances, well, or if they even mention, I guess one of the biggest crazes that was it Bitcoin? Yeah, Bitcoin. If someone mentioned that, yes, cryptocurrency or something like that, I don't want to be just clueless to it. I want to be able to say something about it that I know. Yeah. So therefore, my ability to, or my self-education, my self-care and my self-education also revolves around things like that too. Maybe financial things and what's really happening out there in the world. Other things as far as, things that are happening locally on our, city level. We definitely need to stay involved in that. Being in the county we're in, yeah. We have to be on top of what's happening. There are a lot of different things that are happening on all different levels, even with our law enforcement, with our, the county is able to move us and tell us what we need to be doing right now, whether we need to be locked down or whether we need to be 2.5 or whichever number we're in.
Yeah.
All of those things play a role and a factor in our patients' lives and our clients' lives. So we ought to be able to, we should know that stuff. We should be very much on top of that. So that's one of the things that I myself definitely push my interns, my supervisees, other therapists that call me up, fellow therapists that call me and just, need some advice or talking about different things. We talk about all these different things. A lot of times I try to make that conversation a nice rounded conversation so that they can get something out of it and make sure that what they're getting out of it is just not what I'm saying, it's what they know and what they're feeling also. So they'll be able to connect with their patients, connect with their clients in that way, like you said, that empathy, being able to, okay, so I hear them saying this about this. I get that. I totally understand. And I think sometimes when people hear me say, I get that, or I totally understand, they're just thinking, well, she's just my therapist. How she get that and she totally understand? No, because I am kind of, I'm a person too. And I'm kind of trying to make myself a rounded person that if you come to me about something, I don't act like I know everything. I always say this to people too. I don't act like I know everything. And I don't think we should act like we know everything with our clients and our patients. If they come across and they say something about something that we don't know about, just, like I always say, be honest and say, you know what, I've never heard about that. Can you tell me more? Can you imagine the client or the patient wanting to tell you more? Because you're usually just sitting there talking with them and kind of going back and forth, but now they can tell you more about something that's of interest to them.
Gotcha.
So there's a lot of different dynamics and a lot of different facets.
And what that does too is it puts you in a better position to help the client by identifying additional resources if they need something beyond what you're trained to provide. And I think about how with clients that are seeking a therapist, they are watching this video now and they're taking notes on characteristics and traits that they can look for in the clinician as well, just to give more of a bullet pointed list, right? We've talked about the empathy component. We've talked about a therapist is well versed in terms of doing the research. We talked about a therapist that takes care of themselves as well. What other bullets would you add to that list for the public to identify when they're seeking out mental health providers?
So a lot of times, I think when the public is seeking out mental health providers, I've gotten wild calls. But people have asked me like, oh, what's your orientation? And that's normally sometimes an individual that have a therapist family member or a therapist roommate. So they want to know what our orientations are. They want to know, so what type of therapy do you do and all this other stuff. But I always tell individuals if they're looking for a therapist, make sure there's a good connection there. Make sure it's a therapist that you feel genuine with. Yeah, absolutely. A lot of times I think, and this happens to me on my first call normally with a lot of my individuals that'll call in and say, hey, I need to get something done. They'll tell me what's going on. And then I'll start talking to them. They'll just be like, oh my gosh, this conversation sounds like we're already in a session. And I'm like, well, it's not necessarily that we're already in a session, but I am speaking to you because I hear what you're saying and I truly believe and I truly care about what you're talking about. And if I can't help you, I want to get someone to help you if I can't do it. So a lot of times it's just really having a good rapport with people, yes, but having a real openness to yourself. And I think that openness, going back to self-care, doesn't come until you really realize that you have to sit down and take care of yourself. And you can't be, feel like, oh, I don't want to be vulnerable to anyone. I don't want anyone to see this. I don't want anyone to see that. I tell people all the time, you can see whatever it is you would like to see because whatever you see is your perception. And I'm going to be here to do what I have to do, which is give you whatever it is you came to me to get.
Gotcha. And that's a very important component when you describe that therapeutic alliance. And all the research shows, no matter what modality or theories you're using, if that alliance or that connection or the openness for both the therapist and the client to be themselves doesn't exist, the quality is going to dwindle as well. Absolutely. And, I definitely want to make sure that clients understand it's okay if you don't get it right on the first call.
That is true. Yes. So meeting with a and I always tell individuals this right here too. So when you're calling and you're looking for a therapist, some therapists will take you because you're a person and you need some services, and they feel like they can definitely work with you. Sometimes even asking the therapist or just checking with the therapist and saying, well, do you have any, and you don't have to say personal experience, but you can say, do you have any experiences or know of any experiences around this, that, or the other? That is another good question to ask. Because some therapists may take you in and be like, okay, it's something that I may have had a little bit of in graduate school, maybe a little bit of it in internship, but not a whole lot of it, but I really want to get a lot of it now. Well, we don't really want to practice on our patients when we're out there working. Right. We really want to be able to practice earlier on. And if that was an area, then that would be an area that you would have already, jumped into and practiced a little bit more. Basically have that research part done.
We don't want our clients to be guinea pigs.
Exactly.
And, I talk about that in another video around making sure you find the clinician that has the specialty area.
Absolutely.
And all the training for therapists are similar, but yet they have some distinctive differences. I know for marriage and family therapists, we're required to obtain so many hours working with couples or families by delivering systemic or group care prior to even obtaining the credential. Can you share more about some of your experiences with supervisees in terms of how the programs may differ based on some of the required experiences?
Yes. So a lot of the programs are different. So I think one of the big things is to really say that a therapist can be and it's going to be a lot of us when I say it, a therapist can actually be a psychologist. It could be a licensed clinical mental health counselor. It could be a licensed clinical social worker, which is the LCSW. It could also be a nurse practitioner nowadays. Licensed marriage and family therapist. So there's a good bit of us in the same area that's kind of providing that therapeutic, therapy that everyone's looking for. We're definitely giving that therapeutic intervention and all the other things that we do with therapy. So when individuals hear that or see that, they're like, okay, well, I'm over here, and let me not forget the licensed addiction specialist, licensed clinical addiction specialist. Yes. So they're more so in substance abuse. And then, okay, let me not forget the other one. There's another one with, and I'm not particularly sure what their license is called, but they work with sex addiction.
Oh, license.
I think it's a L.
Yeah.
SAT or something like that.
So you already have to have a license usually, and then you go get additional training to be a licensed sex therapist.
Sex therapist, that's what it is, something like that. So yes, so with them, I mean, all of us are there, but I can always tell everyone, okay, if you're having some marital issues, then yes, seeing a relationship counselor, that would be great. But as soon as that relationship counselor realizes that, oh, there's a sex addiction going on, there's something there, then usually that therapist is going to say, okay, let me go ahead and, if that's my area, okay, yes. But if that's not kind of where I'm, working from, I'm going to refer you out.
Yeah, so finding a clinician that's willing to make the appropriate referrals.
That is correct.
And finding someone that specializes in the area is going to put you in a better direction of getting the help you need.
Absolutely.
Definitely.
And I always tell individuals, I don't think people realize this, but all of our educations, all the educations I just mentioned just now, all of us are doing something different in our educational programs.
They are.
All of us are doing something totally different in our educational programs.
It's not a one-size-fits-all.
Absolutely.
Yes.
So social workers are definitely more administrative. You do have some that are clinical, but their clinical classes are not as in-depth as a mental health counselor or a marriage and family therapist. Their classes are not as in-depth as ours because, again, I always say we're trained to be actual therapists.
Right.
And a social worker might be trained to really be an administrative person. To be honest
case
with
management.
You. Case management.
I used the military example about how social workers are like the Marines. They can do a lot of different things. They can do the water, they can do the land, they can do the ground. And you have other branches of the military that kind of focus in on one particular area.
Correct.
Don't get me wrong, they all go across each other at some point. But for the most part, some areas are known for specialties versus others.
Absolutely.
And the same would be with counseling.
Absolutely.
And you can be a social worker that's licensed and then have obtained additional training in a
Correct.
specific field. So really going to the training. And, you know, I know the interview is almost over. We're almost at time. And I want to thank you for, you know, taking a moment out of your busy schedule. But I want to make sure you share with the viewers a little bit more about your nonprofit and the different endeavors you have going on professionally, because I know you're helping a lot of people in the community, a lot of people nationally, and I want to make sure you share that with us.
Okay. So yes, we do have our nonprofit, the Green McIlwain Foundation. That is a foundation that I came up with my two sons, and both my sons live as adults with their special needs. And with that being said, we have decided we will reach out to families in the community that need some of that advocacy, some of that support, and kind of not sure where to go, how to do this, how do I contact the school, what am I saying to the school. So we've decided to kind of make it a full, all-out initiative that we're definitely focusing on having those clinicians out there that'll be able to assist them. They're almost, we call them navigators. So they're navigators that'll be able to assist families as far as making sure they understand what's going on in their IEP meetings at school, understand what the doctor's talking about, if the doctor's talking pretty much Greek to them, understand what things look like as far as different funds and different services that'll be able to assist their family in the community when they don't have those funds and services and they still have a need because their child has some developmental disability, physical disability, whatever type of disability it may be, that they're able to get those the assistance that they need and the services that are available. And I always say this, these services are available nationally, but people don't realize what these services are and that they can tap into these services and that they're able to, you know, be treated just like the other person's being treated. So that's one of our things, to be able to educate people and to be able to advocate for those families, educate those families, and then be able to link them to resources out in the community that they really need.
That's so needed, because a lot of times people just don't know where to start.
Absolutely.
We get calls all the time, and the client has already put themselves in a position of inability to make the call.
Absolutely.
And to be able to give them access to your organization gives those families that have members within the special needs population an opportunity to get the navigation to a location that's going to supply them with the help they need.
Absolutely.
Love it. That is great.
Yes.
Dr. McIlwain, this has been a pleasure. Thank you for joining us today. If you are out there and you're watching the video, please subscribe to the channel. I'll have in the comment section links to Dr. McIlwain's private practice, her nonprofit, bio, all the information that she discussed today. And we look forward to seeing you guys on the other side.
All right. Thank you so much.
Yes, ma'am. Thank
All
you.
right.
You can never go back. I gotta take it on the other side.